You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Issues. Now you got Trump doubling down on defending himself against criticism from medical experts that his announced use of a malaria drug against the coronavirus could spark widespread misuse and it has potentially fatal side effects. Here's the whiner-in-chief.
The FDA has said hydroxychloroquine should not be used outside of a hospital setting or...
No, that's not what I was told. No, there was a false study done where they gave it to very sick people, extremely sick people, people that were ready to die. It was given by obviously not friends of the administration. And the study came out, the people were ready to die. Everybody was old, had bad problems with hearts, diabetes, and everything else you can imagine. So they gave it. So immediately when it came out, they gave a lot of false information. Just so you understand, great studies came out of Italy on hydroxy. You know what I'm talking about, right? Right? Great studies came out, and the combination of the three. But we had some great studies come out. Italy, France, Spain, ourselves, many doctors. But I think it's worth it as a line of defense, and I'll stay on it for a little while longer. I'm just very curious myself, but it seems to be very safe. But that study was a phony study put out by the VA.
Cable. And here we go. Trump with his usual nonsense. There's all kind of other stuff that's going on when it comes to the issue of the coronavirus. They're spreading crazy information. They're spreading misinformation as well, folks. It makes no sense what is going on. You also have doctors and scientists in the United States and Europe concerned about a mysterious new pediatric illness that appears linked to COVID-19. Instead of attacking the lungs like the adult does, like the disease does in adults, this syndrome, while seemingly very rare, can trigger serious and even deadly cardiac complications in children. Plus, we have false negatives involving coronavirus as well. The Abbott test they've been touting, FDA is warning about that as well. Lots of things to talk about. Let's bring up, of course, sister, you know her so well. We've had her on the show many times. She's been giving great information on this, and there's Dr. Ebony Jade Hilton. She's Associate Professor, Anesthesiology and Critical Care Medicine, University of Virginia, and Medical Director at GoodStock. Dr. Hilton, glad to have you back on the show.
Thank you for having me back. I wish there was nothing to talk about, but here we are.
All right, so we've got craziness from the whiner-in-chief touting this drug, and what's interesting is his own doctor put this statement out, but nowhere in there did the doctor actually say he prescribed the drug. And you know, they're dancing around this, and so what do you just make of the silliness coming from Donald Trump about this drug?
I don't believe him at all, for one. It is one of those things that I think he says things on the spur, and it's unfortunate that we cannot believe and trust the words of our president that's in charge of keeping us all safe and keeping our nation intact. But I think he truly made that up on the spot, which is why he couldn't say the word hydroxychloroquine and tried to play it off, which is why he also couldn't say the word doctors. Also try to play that off. I think we have a problem. But that being said, to either lie about taking it or to pressure a doctor into prescribing it for you when there's known risk and side effects of this drug, when there's no clear indication for you to take that drug, that is insanity in either direction.
And again, you have this constant defense of it, even though the test results have shown it is not doing anything for these people who are suffering from coronavirus. It's like this idiot can't get it through his head that he's wrong.
Right. And the study actually came out of the University of Virginia where I work, looking at VA patients. And what we saw is that it actually had worse outcomes, that those patients who were on hydroxychloroquine alone had higher mortality rates. That means they died. And the thing is, he brought up the fact that these patients were already really sick, that they were really old, they had many comorbidities. But that's the type of patients that we actually have to put you on medicines when you have COVID-19, because you are dying and we're trying to figure out a medicine that could help you not to die. So the fact that this medicine caused more people to die while on it is a bad indication for its utility in medicine. And so even in his own words, he basically explained why we are not using hydroxychloroquine at the University of Virginia.
So, again, the FDA has warned that the only people who should be prescribing this drug is if people are in hospitals. So people who are at home should not be taking this drug just for the hell of it.
Yeah, I mean, this drug is excellent for what it's useful for. Those with lupus, those with other types of conditions that have been prescribed this medication and monitored, their lab work monitored, their EKGs monitored, fantastic. If you have malaria, fantastic. But if you're just taking this as a preventative, as he's suggesting that he is doing, that's not what you do. If anything in medicine, as medical providers, we try to get you off of medicines as quickly as possible because we know that every medicine has a potential for a side effect. Yes. And this medicine in particular has a decent amount of cardiac arrhythmias that are associated with it. And so we try to limit its use as much as possible, but there are certain conditions where people need this medicine, and we need to use that medicine for those individuals and not for someone who's making up things at the spur of the moment on a press conference.
So, for all the folks who are sitting here watching, who are paying attention, I keep saying this. If there's any advice that's coming out of the mouth of Donald Trump, completely ignore it. Even Neil Cavuto on Fox Business was saying the exact same thing.
Ignore it and or do the direct opposite is what I found to be most accurate, because, for instance, he's not wearing a mask, of which, yes, we know that the mask does not 100% prevent any transmission, but he is around how many people now that are testing positive for COVID-19? And for him to continue to be reckless in his practice is absolutely, I think, the pure definition of insanity. At a certain point, you have to realize that we are all mortal. And that he's putting himself and therefore our nation at risk.
All right, I want to bring in my panel here. A. Scott Bolden, former chair, National Bar Association Political Action Committee, Law and Victoria Burke, NNPA. Dr. Jason Nichols, Department of African American Studies, University of Maryland. Jason, I'm going to start with you, and folks, keep Ebony there, Dr. Hilton there. Jason, what I see what's going on here is, and again, I see complete dereliction of duty coming from this White House. You have Trump in these news conferences making people take off their masks to ask questions. You have cabinet meetings where they're not sitting, spacing away from one another. You've got Mike Pence, who says he's not on this drug, but he's been self-quarantining because one of his staffers actually tested positive coronavirus. I would dare say everything that should be done to take precautions against this, follow nothing this administration is doing because they're not practicing what the doctors are actually preaching, Jason.
I mean, I think you pretty much said it all. The fact that, he's taking this drug as some sort of prophylactic against, the virus, and there's no evidence of it. We haven't seen it in any kind of clinical trials. I was just reading a new study out of China that says that none of that works. We saw Stephen Miller got it. His wife got it. It's running through the White House. He's not wearing masks. He's being reckless. He's setting a terrible example. And that's not what leadership is. What leadership is first setting the example yourself in order to make this country safer, in this case, flatten the curve. And he's really, setting a terrible example for, everyday Americans. And now we have children, dying. We had a child in Baltimore who just passed away from, COVID-related illness. So this is a really terrible situation when you have someone who is not responsible and derelict in their duty.
Lauren, here's what I think is happening. And Dr. Hilton, I would love for you to weigh in on this as well. 94,000 people are dead, okay? They've said, oh, it's going to happen by June 1st. At the rate we're going, at the end, look, we may see. I said this last week. It might happen by Friday. They refuse to acknowledge what's going on. Now we're hearing about a woman fired in Florida. They're trying to fudge numbers. We saw what happened in Georgia. I mean, you have, and we already know what the administration has tried to do by questioning the CDC numbers. They want to be able to suppress these numbers because it's bad news for them, Lauren.
Exactly. He's trying to turn the page. And he can't turn the page. I mean, this is a president, as we know, who thinks everything is about PR. He doesn't want to have this branded to him, which it's completely branded to him. And it's completely branded to him because he didn't read his intelligence reports in December and January and February. There's no getting around it. We're going to hit 100,000 in probably less than a week. He is trying to turn this into another conversation and what the economy looks like after this is over, but it's not over because the stats are still coming in. He can't deny that. And, you know, there's nothing like 100,000 people dying to stop all the PR and all the nonsense. And he can't spin his way out of it. He won't spin his way out of it. There's nothing else really to say. The fact that he won't wear a mask is really related to his own vanity and his own PR obsession. He doesn't want to be photographed in a mask. He doesn't want to be seen in a mask. He knows that a photo of him in a mask is the actual epitome of this thing reaching right into the White House, which it already has done. And that's why he's not wearing one. So, you know, he's childlike. We know he's childlike. I think Joe Biden is going to get elected as a result of this and everything else that's about to happen with regard to the economy, which is all going to happen on his watch. And he can't blame anybody else, can't blame Barack Obama or anybody else. And basically, he's trapped, and he knows it.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. This is the Ceek VR headset created by Mary Spiel, the sister. We had her on the show. Black woman. She actually is the inventor of this particular headset. And so what happens is you just simply place your phone right into here, and then of course close it up, and then go to their website and then their app, and you can actually experience the comedy showcase. And so they have these headsets, these VR headsets on their site, Ceek.com, for sale. Then also they have these 4D 360-degree headphones. First of all, I love the two stuff because they're in black and old gold, my frat colors. But these are awesome because for gamers, it comes with detachable headset, and again, folks, it gives you 360-degree sound. Amazing sound. If you want to buy these, you have a promo code you can use. This is just for our followers, and it is RMVIP2020. RMVIP2020. Put that promo code in. If you want to buy the headphones, buy the VR headset, you get that discount to buy it. They're amazing. So Ceek.com, RMVIP2020. Now back to your Roland Martin Unfiltered video.